Hello, my name is Olivia Bailey. My project is titled Machine Learning Prediction and Analysis of COVID-19 Vaccine Rates by State. In January 2020, the Centers for Disease Control and Prevention announced the first COVID-19 case in the United States. As of January 1st, 2022, there have been over 820,000 deaths from and over 55 million reported cases of COVID-19 in the United States. The societal impact of COVID-19 goes beyond public health. COVID-19 has affected American businesses and the economy. COVID-19 has impacted schools and the potential educational achievement of students. COVID-19 has impacted mental health. Vaccinations is key to controlling the pandemic. As of January 9th, 2022, 62.5% of Americans have been fully vaccinated. Fully vaccinated is defined as a person receiving one shot of the Johnson & Johnson vaccine or two shots of the Pfizer or Moderna vaccines. However, there are discrepancies in state vaccination rates. While 78.1% of people in Vermont are fully vaccinated, only 46.5% of people in Idaho are. To understand these discrepancies, my research goal was to create a linear regression model to predict COVID-19 vaccination rates by state using publicly available data sets. From the perspective of socioeconomic factors, it was hypothesized that states containing people with higher educational attainment levels and fewer families on food stamps would have higher COVID-19 vaccination rates. From the perspective of access to and use of medical care, it was hypothesized that states containing people who regularly go to the doctor and get vaccinated for diseases such as the flu would have higher COVID-19 vaccination rates. From the perspective of voting, it was hypothesized that states which leaned more Republican would have lower COVID-19 vaccination rates. For materials, a computer with the programs Excel and Python was used. Excel was used to summarize state data, and Python was used to create a linear regression model, and the code was run in Jupyter Notebook. Here's a snapshot of my Excel spreadsheet. The first column lists the states. The second column shows the percentage of people fully vaccinated. The remaining columns show the data compiled for each state. Specifically, data was compiled for the following 15 socioeconomic factors. Data was compiled for the following three categories related to access to and use of medical care. Data was compiled for the following two categories related to voting. The political party strength average was created by adding 1 if Republican control and 0 if Democrat control to the formula. The formula was control of House Assembly plus control of Senate plus control of governorship, all divided by 3. Python was used to create a linear regression model. The model used the data summarized earlier. The dependent variable was percentage of people fully vaccinated. First, a histogram was generated of the dependent variable, and it was determined to be approximately a normal distribution. Next, the independent variables were normalized. Next, principal component analysis was performed. However, since the first principal component did not explain a lot of the variance, no components were used. Next, a linear regression was created. The data was split using a test/train split with 13 in the test and 37 in the train groups. The model was then trained on the training set. To evaluate the model was used to predict the test set. The initial regression was run using all the variables. A baseline performance of root mean square error of 1.93% for the train set and a root mean square error of 4.28% for the test set was obtained. Steps were taken to improve these results. Each independent variable was removed from the model and a comparison of the root mean square errors from the new and the old models were compared. Depending on the results, the independent variable was either kept in the final model or removed. In the final model, a good train/test R root mean squared error result was achieved. The root mean square error of the test set was 3.45%, and the root mean square error of the train set was 3.41%. Since the root mean square errors are close in value, the model is not overfitting. In addition, a root mean square error of 3.45% reflects that the model is fitting the data well. A good train/test R-square result was also achieved. The R-square of the test set was 0.85 and the R-squared of the train was 0.83. Both R-squared values were close to 1. A good portion of the variance in the vaccination rates was explained by the independent variables in the model. The final model contained 10 variables. Of the final 10 variables, 4 of them relate to computing devices and access to internet. I highlighted these variables in red. This chart shows the variables with positive coefficients. Higher rates of these independent variables are associated with higher vaccination rates. This chart shows the variables with negative coefficients. Higher rates of these independent variables are associated with lower vaccination rates. As highlighted in blue, The results of the model supported my hypothesis that states containing people who regularly go to the doctor would have higher COVID-19 vaccination rates, and my hypothesis that states which leaned more Republican would have lower COVID-19 vaccination rates. The majority of the data from this project came from the 2019 5-year American Community Survey, compiled by the U.S. Census Bureau. One source of error is that the data was collected before the COVID-19 pandemic. If the pandemic had a long-term impact on some of these categories studied, my data may not be as predictive. Additionally, there is potential collinearity between the independent variables. This could affect the coefficient values. However, principal component analysis was run in an attempt to detect and reduce multicollinearity. This research showed the correlation between computing devices, such data plans, and vaccination rates. Future research could be done to study how people obtain and use COVID-19 information from the internet. This research is important because of the spread of misinformation on social media.